Dear students, after studying this module, you shall be able to know about depressant drugs and their classification, some notable depressants and their signs and symptoms, and forensic analysis of depressant drugs. First, introduction to depressants. Depressants, which are often referred as central depressants, are psychoactive drugs that temporarily reduce neurotransmission levels, resulting in retardation in arousal or stimulation in either mental or physical functions or both. Central nervous system depressants, also sometimes referred to as sedatives and tranquilizers. This property makes them useful for treating anxiety and sleep disorders. The effects that depressants generally exert may include pain relief, sedation, perceptive or memory impairment, as well as, in some instances, euphoria, muscle relaxation, lowered blood pressure, dissociation, respiratory depression, anticonvulsant effects, and even complete anesthesia or death at high doses. Due to their rendering a characteristic low feeling, depressants are also occasionally referred to as downers. Depressants have a marked contrast to that of stimulants or uppers, which boost up mental or physical function or both. So both of these are considered to be functionally opposite. Depressants are widely used throughout the world as prescription medicines and even without prescription, both as legal and illicit substances. As depressants calm down the mental and physical processes in body, they can be useful in the treatment of certain medical conditions. But this property of certain drugs also makes them attractive to recreational drug users. These medications have many adverse side effects, and there is a high potential for addiction associated with the risk of destroying their mental and physical health. Next, we shall see mechanism of action. All depressants work by retarding the functioning of the central nervous system. This is usually done by enhancing the effect of a neurotransmitter, GABA aminobutyric acid or GABA. Neurotransmitters are actually the brain chemicals that facilitate the communication between the neurons. GABA is an inhibitory neurotransmitter, which means it acts primarily to calm down the functioning of central nervous system and thereby induce a drowsy or calming effect beneficial to those suffering from anxiety or related disorders. In addition to this, alcohol is able to increase the depressant effect by interfering with excitatory neurotransmitters as well. Similarly, opiates reduce pain signal as well as inhibiting the central nervous system. Now we shall discuss about some notable depressants. First is alcohol. Alcohol acts as a depressant of central nervous system and particularly affects the brain. The extent of depression is in proportion to the concentration of alcohol within the body. Forebrain is the area which is prone to the action of alcohol. But as soon as the level of alcohol in blood rises, other parts of the brain also get affected. About 90% of the alcohol absorbed is oxidized in liver and rest 10% is excreted. Alcohol is oxidized to acetaldehyde by alcohol dehydrogenase, ADH, and coenzyme nicotinamide adenine dinucleotide, NAD, in the liver. This acetaldehyde is converted into free acetic acid or acetyl coenzyme A. The acetate undergoes oxidation to carbon dioxide and water in the citric acid or the Krebs cycle. This acetate can form glycogen, proteins, and also fats and cholesterol. In case of a diabetic who is ketogenic, will produce fat from alcohol as he cannot use the sugar. Alcohol from blood disappears at a rate of 10 to 15 ml per hour, that is 15 milligrams of percentage per hour, and is not stored in the tissues. Due to the increase in liver enzymes, chronic alcoholic can metabolize alcohol faster at the rate of 40 to 50 mg% per hour. Of the metabolized alcohol, 10% gets deposited in the tissues in the form of cholesterol and neutral fats. The absorption of alcohol depends on habituation and tolerance of the individual, as habituated heavy drinkers tend to absorb alcohol more rapidly. Next is barbiturates. Barbiturates are central nervous system depressants capable of producing a wide range of effects from mild sedation to total anesthesia. They are also effective as anxiolytics, hypnotics, and anticonvulsants. Barbiturates also have mild analgesic effects. They have both physical and psychological addiction potential. Since the synthesis of diethyl barbituric acid and its introduction into medicine as a sedative and hypnotic agent, many other structural analogues have been prepared and investigated. Benzodiazepines have now largely replaced barbiturates in routine medical practices. However, barbiturates are still used in general anesthesia. Barbiturates are basically derivatives of barbituric acid as their parent compound. Pharmacological action of barbiturates of all types is the same, that is depression of central nervous system. However, the structural variations result in differences in the rate of absorption and distribution. By altering the dose, the degree of depression can be altered. Phenobarbital has a specific depressant action on cerebral motor cortex that makes it a valuable drug for epilepsy. In hypnotic doses, it has no analgesic action and if prescribed alone in painful conditions. There may be excitement, restlessness, mental confusion, and delirium. Barbiturates act as synergists with analgesics and potentiate the action of alcohol. Barbiturates are cellular histotoxic agents. They produce histotoxic or tissue anoxia and also partially inhibit the cytochrome enzyme system. Toxic action may occur following large single dose or repeated medication in slow excreting barbiturates. Barbiturates are commonly used for suicide more by young male than female, next only to organophosphorus compounds as the former is available easily. Next is benzodiazepines. The benzodiazepines are one of the most important groups of psychotropic drugs. They are widely used as tranquilizers, sedatives, and hypnotics. Benzodiazepines enhance the effect of a neurotransmitter, gamma-aminobutyric acid, GABA, which acts primarily to calm down the functioning of central nervous system and thereby induce a drowsy or calming effect beneficial to those suffering from anxiety or related disorders. Its prominent effects include pain relief, sedation, anticonvulsion, muscle relaxation, etc. These properties make benzodiazepines useful in treating anxiety, insomnia, agitation, muscle spasms, alcohol withdrawal, and a pre-medication for medical or dental procedures. Benzodiazepines are one of the safe drugs when their overdosage occurs alone. Many benzodiazepines have active metabolites that account for their prolonged sedative effects. Benzodiazepines potentiate the effects of other CNS depressants, particularly alcohol, tricyclic antidepressants, and barbiturates. Flurazepam is most likely to produce significant central nervous system depression. Ethanol has a synergistic effect with benzodiazepines and increases both the rate of absorption as well as associated central nervous system depression. Similar effect is also seen with concomitant administration of phenothiazepines and barbiturates. Sodium valproate may cause psychotic reactions when given along with benzodiazepines. Most benzodiazepines are administered orally or by intravenous injection. Intramuscular injection may lead to erratic absorption. However, lorazepam and midazolam are exceptions to this and can be given intramuscular. Following absorption, all benzodiazepines are bound to plasma proteins to the extent of 70 to 99% and are metabolized extensively by different microsomal enzyme systems in the liver. Metabolites are invariably as active as the parent compound. Next is opioids. Opiates are found in opium. The major active opiates found in opium are morphine, codeine, thebaine, and piperine. Semisynthetic opioids such as heroin, oxycodone, and hydrocodone are derived from these substances as well. Opiates can be injected, snorted, or smoked. The short-term effect of opiate abuse consists of a surge of euphoria coupled with a warm flushing of the skin, dry mouth, and heavy extremities. Following initial euphoria, users alternate between a wakeful and drowsy state. Mental functioning becomes clouded due to the depression of the central nervous system. An opioid is a chemical compound that works by binding to specific opioid receptors in the brain, the central and peripheral nervous system, the gastrointestinal tract, and other tissues in the body. The opioid, which is derived from natural alkaloids found in the resin of the opium poppy, is among the oldest and most widely used substances in history. Contrary to popular misconception, opioids are not depressants in the classical sense. They do produce depressing effects in central nervous system. However, they also excite certain areas of the central nervous system. The term narcotic correctly identifies these drugs. However, they do have depressant actions nonetheless. Opioids may be classified as pure agonists and those with mixed agonistic and antagonistic actions. They undergo oxidative metabolism catalyzed by cytochromes P450, of which there are several hundred isoforms. Cytochromes P450 requires the presence of molecular oxygen, NADPH cytochrome. Opioids such as hydrocodone, also called as Vicodin, oxycodone, also known as OxyContin, and hydromorphone, also called as Dilaudid, are typically prescribed by a medical doctor to treat pain following a physical injury or surgery. Extended use of these medications inevitably leads to opioid abuse, in which the user must consume higher doses in order to achieve the desired effect. Used as a painkiller, the analgesic effects of opioid use include a decrease in perception and reaction to pain, and increased pain tolerance and euphoria. Medical importance. Depressants describe a class of pharmaceutical compounds that work by decreasing electrical activity in the central nervous system. Some depressants work by altering the chemistry of the brain to increase the amounts of chemicals that naturally block neural activity. Although depressants have a high potential for abuse, they are invaluable in the treatment of certain disorders. One use of depressants is for anesthesia. More specifically, central nervous system depressants like barbiturates are commonly used as pre-anesthetics, which means that they are used to prepare a patient for general anesthesia. These medications rapidly put the patient to sleep and allow for lower doses of more potent anesthetics. Another use of depressants is in the treatment of anxiety. Benzodiazepines and barbiturates are also effective as sedatives. By depressing brain activity, these depressants are also able to help patients fall asleep. Barbiturates can be used to treat sleep disorders, as can benzodiazepines, because both medications can take hours to get out of the body. However, another class of medications has recently been developed for the treatment of sleep disorders. Depressants can also be used medically as anticonvulsants. Anticonvulsants work to lower the overall activity in the brain, thus helping prevent the abnormal electrical activity that can lead to seizures and epilepsy. Barbiturates are commonly prescribed to help treat seizure-causing disorders such as epilepsy. Sodium oxybate is a central nervous system depressant that can be used medically for the treatment of narcolepsy. Narcolepsy is marked by patients suddenly and uncontrollably falling asleep. Sodium oxybate works to prevent the sudden muscle relaxation that narcolepsy can cause. Next is abuse. There is a relatively small difference between the desired dose and an overdose. The later one categorizes itself in abuse category. Abuse of depressants is not very uncommon. People are generally attracted towards the depressants to get rid of the unwanted situations in their lives. Depressants slow down the activity of the central nervous system. Addiction to some depressants can quickly lead to medical, psychiatric, and psychosocial deterioration. Those individuals who abuse depressants will tend to exhibit certain symptoms. Depressants are prescription drugs that promote sleep or calmness. They are called as central nervous system depressants. Alcohol, tranquilizers, opioids such as heroin and benzodiazepines are also types of central nervous system depressants. The central nervous system consists of the brain and the spinal cord. When central nervous system depressant agents are used, the breathing and heart slows down. If these slow down far enough, the person loses consciousness and can go into a coma or they can die. Despite this fact, there are many central nervous system depressants on the list of commonly abused illicit or prescription drugs. When a person uses a central nervous system depressant, they do not feel as anxious and they are more able to sleep. The most common signs of depressant abuse includes apathy, secretive behavior, reduced productivity, periods of depression, less interest in personal hygiene and grooming, mood swings, and also inability to keep up with their family and social commitments. Next are signs and symptoms. Depressants produce a wide range of different kinds of effects by retarding the activity of the central nervous system. However, dose of a depressant that is taken is the key that regulates the effects produced by that depressant. Long-term use of depressants can produce depression, chronic fatigue, breathing difficulties, sexual problems, and sleep problems. As the dependency on the drug increases, cravings anxiety or panic are common if the user is unable to get more. Tolerance to many depressants can develop rapidly with larger doses needed to achieve the same effect. Now we shall see the symptoms in acute intoxication and chronic intoxication. In case of acute intoxication, retarded brain functioning is there, lowered blood pressure, poor concentration, confusion, visual disturbances, dilated pupils, fatigue, fever, sluggishness, disorientation, depression, slowed pulse and breathing, dizziness and slurred speech. In case of chronic intoxication, there is depression, also chronic fatigue, breathing difficulties, sexual problems, sleep problems, cravings and also anxiety can be seen. Next is withdrawal symptoms of depressants. As with other drugs of abuse, it is possible for individuals to become dependent upon or addicted to depressants. The withdrawal symptoms from this type of drug may be unpleasant, but they will usually pass after a short period of time. The real problem for people in early recovery is that they can feel life to be flat without these substances. Withdrawal symptoms include insomnia, weakness and nausea. For continual and high dose users, agitation, high body temperature, delirium tremens with alcohol, hallucinations and convulsions can occur. Unlike withdrawal from most drugs, withdrawal from depressants can be life-threatening. Besides, additional symptoms include agitation, body aches and pains, confusion, changes in pulse, respiratory rate or blood pressure, digestive problems, tremors and body spasm, heart palpitations, etc. Next is forensic analysis. The presence of depressants in the body may be tested by a variety of procedures. Serum and urine are the common sources of testing material. Color tests, chromatography, immunologic assay, and mass spectrometry are the most commonly used techniques employed in such analysis. Depressants are also occasionally referred to as downers, as they lower the level of arousal when taken. Depressants, which are often referred as central depressants, are psychoactive drugs that temporarily reduce neurotransmission levels, resulting in retardation in arousal or stimulation in either mental or physical functions or both. All depressants work by retarding the functioning of the central nervous system. This is usually done by enhancing the effect of a neurotransmitter, gamma-aminobutyric acid, that is GABA. Depressants are generally used therapeutically for treatment of a number of indications like insomnia, as general anesthesia, in pain reduction, anxiety, and to promote muscle relaxation. The effects that depressants generally exert may include pain relief, sedation, cognitive or memory impairment, as well as in some instances euphoria, muscle relaxation, lowered blood pressure, dissociation, respiratory depression, anticonvulsant effects, and even complete anesthesia or death at high doses. The presence of depressants in the body may be tested by a variety of procedures. Serum and urine are the common sources of testing material. Chromatography, immunologic assay, and mass spectrometry are the common techniques employed in such analysis. One of the most famous cases during this period concerned immortal Hollywood actress Marilyn Monroe, who at the end of her short, tempestuous career became hopelessly addicted to alcohol and barbiturates. In 1962, at the age of 36, Marilyn Monroe was found dead at home following an overdose of barbiturates.